And as far as I know, for us, we've budgeted for that enough as far as the parliament is concerned. There was enough money budgeted in last year. It's never enough though, because even I can say, even up to 50% of the needs for the drugs or the facilities, because this is an issue that is ongoing. We have been informed several times. And then even the National Pharmaceutical Service one time appeared here, they presented to us the drug need of the country. But the resources that we always allocate are not enough to buy all those things. But what we have is important. We tell the public this is what we have. So, honorable members, once again, thank you very much for coming and honoring this invitation. Today we don't have a full house because our members, some of them are on other committees. They are going on tour and some travel. But as far as proceeding and procedures are concerned, we have a quorum and we are good to proceed. So thank you very much, Honorable Minister. The floor is all yours and your team.
Thank you very much, Honorable Chair. Thank you very much, distinguished Honorable Chair and distinguished Honorable Assembly members. Thank you for giving us the opportunity to be here today to share with you the situation of supplies, drugs and other medical supplies in the country. As we are all aware, the availability of drugs and other health consumables, medical consumables, is very critical to the success of any health system. All health systems require adequate amount of drugs and consumables. In the case of the Gambia, it is not different. What makes that of the Gambia different is 100% of the drugs and medical consumables we use in our hospitals are imported. That makes it unique and different. Not a single item is manufactured in this country. And the items we need for the health sector goes beyond 500 individual items, and each of those has to be imported. But I must first of all thank you very much, the National Assembly and the government of the Gambia, the good work you've been doing together, because we must let the people of this country know, since the coming into office of His Excellency's administration working closely with you, what is budgeted for drugs and medical items in this country has increased fourfold. That is a big plus. It has increased fourfold or more than fourfold, and we thank you. However, as you are aware, each year there is a quantification process. The health workers, the hospitals, the regional directorates, and the central level officials and the National Pharmaceutical Services Department Directorate, they sit together and also inviting the experts to look at historical information of what was used the previous year, what the needs were, and using disease trends, they project the requirement for the subsequent year. So they call that process quantification. Now, after each quantification method, usually what the expected requirements are is listed. When that is listed, then we look at also the expected budgetary allocation for the year coming. Now, but at this juncture, it's important for us to note that usually, realistically, what we need as a country, according to the quantification, the funds that are budgeted, even though there is a huge increment, but it can cover only about 30% of the exact national requirement. So, yes, there are increments in the budgetary allocation, as I mentioned, fourfold, but even that fourfold is just 30% of what we would have needed to ensure that drugs are available 24/7, 7 days a week, and so on. This being said, the procurement process then starts. Distinguished honorable members, I think it's important for us to note that the procurement system of GPPA, in as much as it is good to safeguard, to bring about accountability and transparency, but for the drug procurement, there are a lot of challenges. A lot of challenges. Now, the back and forth, the timeliness of quantification, preparation of bidding documents, sending the bidding documents to GPPA to get approval, bringing it back, contracts committee meetings, advertisement of these drugs, evaluation of the submissions, and then selection, standstill period, contract signing, release of funds from Ministry of Finance before these individuals could even be allowed to now submit those lists to the companies, manufacturing companies. It's estimated to take up to 6 months, this whole process. Now, if this takes 6 months of the year, if it is for 2024, for example, and then we need to procure for 2025, if we process in 2024, all these things take place. Now, but the budget, the allocation for 2024, 25 wouldn't have been out because it will start in January. So that means even if these things were allowed to go ahead in 2024 for 2025, then it's only in January 2025 they could be paid an advance payment. And now for 2025. Now that advance payment now, it's most of them, it's after payment that they start counting the number of days they will take to supply. Quite a number say nothing less than 90 days. That's already 3 months. So you see that has gone up to March, April for that particular year. So this procurement method is a big challenge. Now, if it were to, procurement were to start in 2025 itself, then you can imagine it will take towards the third quarter of 2025 for anybody to be able to get those supplies. This is one aspect. But I think beyond all that, the major problem we've been having is the unreliability of the suppliers. When these tenders are floated, it is international competitive bidding. A lot of suppliers participate. Our team does the assessment, evaluation, and all. Winners are selected. For the past few years, those that won the biggest chunks of these drugs are Gambians. We are Gambians who won, Gambian suppliers. But unfortunately, they've not been delivering on time. The previous supplier, 2-3 years ago, in fact 4 years ago probably, supplied some. That time, the issues we got were...
Sorry. Please tell us because of...
The complaints we got were COVID-19 affected manufacturing because some of the factories had to close. Some of their people got sick. Then because of that, some of their people got sick. Because of that, the factories could not produce up to maximum level. Then we had of the shortage of containers worldwide because of COVID-19 pandemic. Then they were also mentioning that shipping lines were not coming as they used to, and so on and so forth. But we realized that our suspicion was that probably the supplier, even though his documentation was all correct, but probably the supplier did not have the capacity. So when they don't have capacity, of course, when our team follows the GPPA rules, they qualify. But you realize that they wait for submission, they wait for allocation, funds to be given to them, for them to be able to do. So, suppliers who typically have capacity, those ones sometimes, they can even, after signing the contract, they make their orders. And then those drugs could get here even before the payments. Of course, occasionally, there are payment delays also on the side of the government when we are supposed to pay. Occasionally that happens, but the majority of the problem is on the side of the suppliers. These current supplies that we are expecting for 2024, now a similar thing happened. Some of the suppliers did supply in time. In fact, when they got the contract, they supplied. Even before they got payments, they mobilized because they have capacity and they supplied. Now, some of them, after winning, they withdrew. After winning, after going through the whole process. So when that happens now, then you are in a dilemma. You have gone through a process of almost 6 months. Now somebody won, only for the time for him to start mobilizing to supply, he said he has withdrawn. What do you do? Even if you take them to court, but that court process will not bring the drugs here immediately. So that is a big challenge for us. The other one is having capacity problems. But after winning the contract, now the suppliers come to say, or a supplier came to say, he wants A, B, and C modified for him. So these are some of the problems. And of course, we refused. One of those kind of things was everything had been itemized in the bidding documents, including registration of these drugs. And they said they are going to be able to do that. Only at the time of delivery, the contract was signed, I think in November, end of November, early December. And then, well, I think it was December. And then the supply was supposed to be 3 months. That was supposed to be end of March 2024. And that supplier has the bulk of the drugs to supply. But just to tell you the challenges we face, initially the supplier indicated that he wanted the registration requirement to be waived for him. He said, no, that was in the bidding document. So it is like they win, and now after winning, they want to change the rules. Of course, we did not agree to that. Now, back and forth, then he said, well, MCA should help, ministry should pay for the registration fees to MCA, so that from the monies that the ministry is supposed to pay him. So that means him claiming to have capacity was not correct. Because if he had capacity, because this time around, so that government funds don't get locked to the suppliers, paying them and then government continues to follow them. The requirement was for them to pre-finance. They pre-finance, they buy, and when they supply, government pays them. So now that he's saying government should pay for the registration fees at MCA, that means that supplier did not have capacity to do so. But in the process, they would have provided all the required documents. Now, this went on, and we insisted no. Now, apparently, later on, we realized that some of the orders this supplier did not even place with the manufacturers. When the ministry said, now bring the requirements, ministry could talk to MCA so that the process of registration gets expedited. The supplier did not provide dossiers of those items. He kept on saying, these were sent by DHL. And to the best of my knowledge, they have still not arrived by DHL. Now, suggestions were made to him. Why don't they get some of the items from the sub-region, where they could even bring them in trucks? Within a week or two, when the drugs are tested and packed in trucks, we could get these drugs here. They looked at that, which he bought into. They started the process, but even that process was slow. There were times that he shared truckloads of cartons with my team, and those truckloads were not even true. Those items never came. That means they took truckloads that were not even meant for Gambia. So sometimes these are the serious challenges we have. Now, eventually, some drugs came from the sub-region using that method by the same supplier, but the delay had already been done. Distinguished honorable members, this has been a big challenge. So what really affects drug supplies in this country mainly is the procurement method and the unreliability of suppliers, most of whom are Gambians. This is our major problem. Now, as we speak, it's important to also say, in as much as there are challenges, in 2024, 45 containers, both 40 and 20 food containers, arrived here by the seaport. Through the airport, 121 consignments came. Going back to the containers, out of the 45 containers, 40% were procured by Ministry of Health, and in some cases, in collaboration with other partners. The airport, 121 consignments, 10% of which were procured by the ministry. And by road, 6 truckloads of medications and other items came. All these were procured by the Ministry of Health. These include a lot of life-saving items. A lot of life-saving items are now present in the country. As we speak, looking at what is in our stores, that means what is available, up to 40% of the essential medicines are available and are in stock. So this is very important. But to complement all this, honorable members, it is important for us to also remember this is separate from the drugs that hospitals are able to buy on their own. These hospitals have internally generated revenue using the drug revolving fund mechanism, and these funds are majorly to be used to procure medicines and medical consumables. So that complements this. So in the hospitals, we expect more than the 40% of drugs to be available. And I can attest to that myself. I have been going around the hospitals, and each time I enter their hospital stores, I see, in fact, drugs in all the groups in all the treatment groups, treatment categories. In the hypertensives, antihypertensives, you see the drugs. Antibiotics, both oral and IV, you see them. Anti-diabetic drugs, you see them, and so on and so forth. So for each category, drugs are available. Of course, we do not have all the drugs for a particular category. And it's important, as we made clear to Edward Francis last week, Wednesday, when we went on rounds, that it's important for the hospitals also to provide weekly drug bulletins. The weekly drug bulletins help the prescribers, the doctors and the nurses, to know which drugs are available. An example is, if people want to prescribe ibuprofen, and they keep on prescribing ibuprofen, and then they keep on getting not available. Maybe the stock level of diclofenac is high there. But if the prescriber's prescription tendencies is towards prescription tendencies are towards the prescribing of ibuprofen. The diclofenac will stay there until it expires. But maybe they didn't know, and maybe that prescriber really wouldn't have minded whether the patient gets diclofenac or ibuprofen. Probably that prescriber is only interested in the patient getting a non-steroidal anti-inflammatory drug, and then diclofenac would have done. But he didn't know that you have a lot of diclofenac in the hospital. So that's why we said the hospital teams must make sure they provide regular drug bulletins to guide the prescribers. When we go to the smaller health facilities, they have also, as we know, traditionally been getting the results-based financing model contributions, whereby World Bank and Gambia government have partnered to provide additional support. And as we all remember, that support, 40% was meant for staff bonuses, and 60% was supposed to be spent on the facility for maintenance and for procurement of drugs and essential commodities. And this also is additional financing for procurement of drugs that is different from the central supplies. So if this is managed well, that means it will close the gap. Now, yes, RBF has been transformed, so to say now. We're not getting the RBF now, but it is being replaced. It is being replaced by the National Health Insurance Scheme. And the National Health Insurance Scheme is operating in a similar way, whereby facilities carry out functions, they issue out drugs, and then they send those their requests to the National Health Insurance Scheme that reimburses them for that, and then they get additional funds to procure drugs and to use for other services. And as I speak to you, distinguished members, many of these facilities, those are in the pilot form. I think about 12, 13 of them, 13 of them have received such payments. And some have already bought some items from it, some drugs, and some are in the process of procuring some of these drugs, including Brikama that I visited. Brikama Island received, or is supposed to receive, over $1 million, from the health insurance. And other health facilities have even received more than that. So this is actually supposed to be used to buy medicines and laboratory items for some of these facilities. Honorable members, we also have a long list of the items that are available and we'll share with you. But at this juncture, I would stop at this point. If you have specific questions, we could go ahead to answer those. And my team is also available to contribute to this submission that I'm giving. Thank you very much.
Yeah, thank you very much, Honorable Member. I think that was a very, very good presentation. The purpose of the meeting is concerned. But state for if any of your team wants to say anything, you are welcome. So we come with
Good.
some comments.
Any comments, additions to what I've said, please?
National Pharmaceutical Service. Okay.
Yeah.
Okay. Thank you very much. Then I think we can move on to the other segments. So, honorable members, I think we have what he presented here. Of course, he talked a lot about the processes involved and some of the challenges they've highlighted, and they will share the communications, this presentation with us, so that we can include these things in our minutes. I understand no sufficient funds, so I think that is a point for us to note that whenever we budget, it can only cover, despite the increase, only 30% of the needs. I think it's something that we should take note of as a parliament. GVL procurement, I know that that's going to generate a lot of questions and of course comments. And reliability of supplies, that's where I know the issues are definitely more centered, because You prioritize, they are all Gambian supplies, as you said. And at the end of the day, they are not able to deliver. And we hear people talking, medicines are not available, drugs are not available, and so whilst the portfolio ministry and of course the government of the Gambia have done all the necessary things as far as the allocation is concerned to follow the rules and then the procedure and the processes to make sure that they get supplies, but at the end of the day, the supplies are reliable. Of course, we highlighted some challenges in the importation process, the registration, which you know that you cannot wait as far as those are concerned, unavailability of containers at one point, cement line issues, and so on. Due to some global public which we are all aware. So these are some of the issues that he highlighted at the minimum. So the floor is open, honorable members, if you have any further questions, comments, you are welcome. I will advise, and then we will have. So the floor is open.
Yes, thank you very much. Well, I have few concerns. One of the issue is the issue of the GBPA. We would want to know what are the challenges that is hindering the process so that we can also challenge it with GBPA. Understanding this problem with your team, what suggestion do you have as a solution mechanism to make sure that these things is not happening? I remember years ago, then the Gambia government signed a contract with one company in Egypt, and they were supplying 5 years, if I may right. And you can see this issue of procurement and whatsoever was addressed, and the trust was there. At the time, that company would even suggest in giving drugs, although I think it was detrimental to the CMS, but there was a system that allowed that uninterrupted processes. With you and your team, do you have a solution that will remedy this current situation? Because if I really right, meaning that the assertion that people are saying that the inavailability of drugs, and now in your testimony, it's like 30% available, if I am right, meaning that less than half of the expected drugs that should be available in the public services is not, if I am right, and I want to be corrected.
Yeah,
that's the question.
Mr. Honorable Minister, I think, and your team, I think you've taken note of the question, but before he
By
Parliament
yeah.
can only care for 30% of the needs as far as their qualification is concerned. And when we came to Parliament in 2017, these are the issues that we are celebrating, that the previous regime were doing single sourcing for medicine. This I can fully remember. And when we came in, they said now it's international bidding. We are also celebrating in the whole, these are so many challenges. But this is just, as far as I was here, and I'm still here, I can share this thing. So Honorable Minister.
Yes, thank you very much. I'm happy you bring in that point, which is very important. So going by the percentage, we are talking about what is quantified nationally and what is available and what funds are made available. But the current availability of essential drugs, because we have a national essential medicines list, and then what is in the CMS now, up to 40% is available. 40. But this is different from what the hospitals buy for themselves, because hospitals have income. So if you put together what the hospitals buy, it could go to up to 60% in the hospital. So that's why when you go to, or even more, because I was saying earlier, when we enter some of the stores, because when I go to visit the hospitals, I enter the stores and I check what is there, and even what is on the dispensing table. You see, all the disease groups, virtually those that are dispensed or over the counter, they have some drugs belonging to some of those groups. For example, antihypertensives, you will have them. Anti-diabetics, you will have them. Antibiotics, you will have them. Of course, you will not have all the antihypertensives in the world or on the essential medicines list. But you'll have those that the patient can do with most of the time. So this is what we say, and we are encouraging the hospitals to produce regular drug bulletins so that the prescribers know what is available. Because if they prescribe and put a particular name sometimes or a particular thing, if you take it to the pharmacist, as you know very well, if it is not there, that one that the prescriber said, they will get NA. That means not available. But meanwhile, as a particular drug is there in the same group, that will also suffice. And they didn't know that that was there. So we said they need to communicate more. Okay. I'll also go to, and sometimes the improvements at the point of care. I'll give you one example. I went to Brikama Health Center. I went through the whole store. I mastered everything in the store. Then I came out to the dispensary. I stood there and I asked the dispenser, yes, what drugs do you have? She was happy because she was able to dispense. And I mentioned, what about this drug? Do you have? He said, yes. What about that drug? No, we don't have. I said, no. I just saw it in the store now. So you see that communication. Then they look around, her supervisor said, no, but we have it. She looked around, it's standing there. So if patients have been coming and that drug, she would have been saying to them, not available. So that oversight we need to strengthen and, teach our people to know what is there and so on and so forth. And also, sometimes we also have people, sadly, who do not pay much attention to detail, and it's easier for them to say to patient not available without checking. That is in the minority, but occasionally we get those reports. Coming down to the procurement method, yes. So these have been the challenges of the international competitive bidding, especially doing it annually, every year. The annual one is a problem. So this is the request we have for you, honorable members, to help us to do it for a longer time. Probably 3 years, 5 years if they are good, but at least 3 years. So that when we know that there is a contract between these people and government and they continue to supply. The process itself of selecting those people should be competitive. That one. The competition is important. It's good. It brings about transparency, accountability, and value for money. So, but for a longer duration. The one that used to be there previously has its advantages and disadvantages. The disadvantage, because I also tried to find out, disadvantage that I was told, when you compare it with the international competitive bidding, the prices in the international competitive bidding were much lower than what those people who had that supply contract were offering. So it was more savings for government and the people of this country. So, but if we go into such, the process of recruiting the particular supplier should be competitive. And then the duration could be longer. These are the kind of things on our minds.
Can I just interject? Now, between these two processes,
yes.
For us as representatives of the people, what you obviously is drugs in the facilities.
Yes.
Between those two processes, which one you think is more suitable as far as availability at the local level is concerned?
Which one?
Between the international competitive bidding and
yes.
the single sourcing.
So the international competitive bidding could have a clause. The duration of the supply could be longer. If we have international competitive bidding with longer supply period contract, I think it's better than the international competitive bidding with just 1 year contract. And then I think it's also going to be better than single sourcing for a longer period.
Thank you. It's a similar point, really, just to elaborate a little bit more. With the previous system that we had in place, also the product range was quite limited. Now that we have gone international, we have been able to provide a variety. For example, in each category where we were limited to 1 or 2 drugs, we can now get a variety in that particular category. We know that medicine is advancing every time. We don't want to get stuck with the same drugs. So as medicine is moving, we have been able to produce a wider range of products or procure a wider range of products for the people. So what Honorable is saying is like a compromise, I would say. There's a process called supplier pre-qualification. It's a rigorous process, but I think at this point we've dealt with enough suppliers
to know who are reliable, to know who produce, who bring about the quality products. Of course, it doesn't bypass the GPPA or the Medicines Control Agency systems. These pre-qualified suppliers would still have to follow all of those rules. But what it means is that you have a kind of a framework agreement with certain suppliers who follow the rules in terms of delivery, in terms of quality, in terms of every other thing that there is, transparency and everything. But at least you are assured that these suppliers I'm dealing with year in, year out, and they're going to deliver as required. They're going to deliver the quality products. And in some cases, even if the payments are delayed, there's that understanding where they continue to produce, to bring in the supplies. So I think that the system that probably we ought to push for is that kind of hybrid. Yes.
Thank you very much. I think positive from what the Honorable Minister just submitted, and of course, as you elaborated, I think we will take note. I think Honorable Member, we need to engage the GPPA and then see where we are, because I think it is important that it be competitive. But like you say, every year doing the same thing, same process, is something which is causing delay. Like I understand what the minister said. What was meant for 2024 will go to 2025. What was meant for 2023 will come to 2024. So the cycle keeps going, and then the challenges still continue to be there. So I think there's something that can be done. It is us who make the laws. If there is any recommendation, also as per some of these procurement laws, please recommend to us. We don't mind coming up with a committee bill and changing to make sure that the people have what is best for them, and then at what is make sure availability is not also compromised. So,
I was thinking, I just wanted Mr. Savali to update us on, because the 2024 procurement had not been completed, and that process is on, but they have gotten some new people who have started supply. So you want to give us an update on that.
Thank you.
Thank you, Minister. Members. Before I give that update, I just want to elaborate a little bit on the competitive bidding and single sourcing. As you rightly said, I mean, it has been single sourcing for quite a long time between the then government and then a supplier in Egypt. But after the change of government, we realized that this is not creating value for money. In a simple straight interpretation, when you are getting 1 tin of amoxicillin from that Egyptian supply, you can get 3 tins of amoxicillin from international competitive bidding. So that's create more wealth for us and give value for money for us. So that's why we departed from that arrangement to international competitive bidding. And I think we need to stick to that. Yes, we want to, several attempts have been made to do a framework arrangement. However, if a supplier didn't perform, you cannot continue framework arrangement. You have to call it off. And that has been also our challenge. But as alluded to by Fatu, I think pre-qualification of suppliers is one way that we can embark on. So far, so good. We have done some requests for quotation after we realized that the suppliers for 2023, 2024 contracts were not performing optimally as we requested, as required. Two of them withdrew. One that has the chunk of the item, about 190 something items, can only deliver 20 items as of now. So we decided to have a quick fix, and that we ran a RFQ. And then we've contracted about 4 suppliers. These are international suppliers. And then so some of them have started delivering as of now. One of them is MPP. They have about 15 items. And then we've received 5 of those items last week. These are short-gap measures. And again, we contracted another suppliers called Angel Pharmaceuticals. They have given 17 items. And out of that, we received a notification this morning that 10 of those items are on their way coming, and these are coming by air. We also contracted Multi-G. They performed in the last contract, and then we extended some of the items that they won to them. They had about